Hi, my name is Birdie Siegel, and I'm presenting about the agency I work for, Area Agency on Aging and Disabilities of Southwest Washington. In 1973, area agencies on aging in the United States, AAAs, were formally established with the Older Americans Act as on-the-ground organizations to support ill-protected elders and people with disabilities. AAAs provide in-home care to support independence and dignity. Every county in the US is served by a AAA. Before 1973, varying organizations and cities had begun to support and work for the disabled and elderly in the US through community organizing going back to the late 18 and 1900s. This organizing grew out of the age of industrialization and charity style helping through philanthropists and religious groups. It was more common in cities, and also it was fraught with systems of domination and oppression, core tenets of colonization. But by the 1960s and 70s, some improvements were in place for aging adults and people with disabilities. Because of the differing needs of vulnerable adults in each distinct community, rural and urban people suffering in different ways, the Older Americans Act was designed with funding standardization, but keeping variability in mind. Odswa's vision is that the communities in Southwest Washington have access to information and programs, services that help them thrive in the setting of their choice. Odswa is a nonprofit quasi-governmental org, simply meaning it has some connection to city, state, and federal government, but is not fully controlled by it. You can see the funding comes from varied sources. These are the average budget across the country of AAAs in 2021. Medicaid here at 60%, the big slice of the pie. We've got some locals, probably city donations and other local funds, some federal at 1%, and then Older American Act is 9% of federal budget. And then we've got that last bit of 8% at the statewide level. I could not find the breakdown of funds for our Southwest Washington AAA. I do wish there was more transparency for the public and employees. I noticed that King County, Seattle area AAA had a beautiful breakdown on their website, and I think that'd be something that we could strive to do. Uh, our quasi-governmental agency in many ways reinforces rather than challenges governmental powers just due to its relationship with its funders. And that's always going to be a balancing act for an organization like ours. Our AAA model is intended to make direct services available and easy to access for care receivers who are low income. However, research has shown that Black and Latino care receivers and young adults are most at risk of their Medicaid benefits being terminated despite remaining eligible. And this is from research in 2023. Our clients struggle with chronic financial, medical, and mental health crises and often fail to keep up with the complicated paperwork and deadlines required for their eligibility on their own. Much work remains to fundamentally integrate this historically disparate medical managed and community-based care systems. So let's look at a systems view, dancing with the problems, county, state, and federal level. Uh, Medicalized social care is an issue. Complex social inequalities are viewed with a clinical biomedical lens and diagnosed and treated as individual pathologies and problems. This fuels an overemphasis on personal health care services as the primary avenue for promoting health. It depoliticizes many issues that people with disabilities and the elderly can have in common, being strategically devalued, having a lack of access to housing and income, and facing daily discriminations. Two, volume versus quality. At the federal level, with the push for managed care organizations, aka the middleman, the for-profit insurance company, this brings with it a more consolidated and obscured process for our clients. Because of the further integration of Medicaid and Medicare with managed care, case managers, resource specialists, and volunteers need specialized training and should be paid accordingly for the increased skills needed to provide trusted, unbiased local sources of information. Our AAA should continue to promote entrepreneurial opportunities locally through waivers to boost the supply of direct care workers in the immediate community, often involving neighbors, friends, and family of our clients. It's no surprise when local contractors provide higher quality and more responsive services. And as described, these waiver programs are key to expanding coverage and advancing the whole person care ideal. Finally, three, privatization of caregiver management. Washington's DSHS oversees more than 48,000 individual provider caregivers statewide. A person with Medicaid in need of at-home care hires an individual provider and the state pays for and oversees the caregiver. But due to overwhelmed staff, the state moved these employers to a contracted private company in early 2022. Upon hiring, they had a lot of things going on. They require sometimes 4 to 6 week long background checks. It's hard to get started as an employee. Some caregivers have been left without pay for weeks due to mismanagement. And here we are navigating rapids and obstacles. If Odswa wants its legacy to be known for helping people thrive and not simply sit resting in the buffer zone as a mediator between the ruling class and the rest of the population, to start with, the advisory council, the leaders, and team in this organization should reinstate and prioritize diversity, equity, and inclusion at all levels. What would it feel like for the advisory council, the COG, and management to take DEI trainings alongside new employees? The trainings need to be in person and in small groups for meaningful and nuanced conversations to spark real action and change. At the doorstep of 2025, Odswa and the community it serves is facing a daunting time. I'd like to read a quote from Canadian author and social worker Walter Chan. Healing comes through allowing the conscience to speak to the needs of the material world, promoting right relationships in work, play, and self-care in ways that build community and honor human differences. There are solutions. A few that I want to highlight are I'd love to see the agency consider creating a case manager practicum for grad students, and maybe down the road providing tuition reimbursement programs. And as stated before, that core concept of DEI at the heart of the organization. And then I also think that we could focus on community partnerships with local organizations. Some key areas for improvement for our clients. Communication, not only clearly explaining benefits and eligibility requirements, but actively listening to their concerns and needs, using a we're in this together approach. And of course, advocacy always, appealing denials of coverage when appropriate, and watching carefully for systemic barriers in bureaucracy for our individual clients. Engagement. We need to always build rapport and build trust by entering their experience the best we can and being willing to work with the whole person. Now let's look at some areas of improvement for employees at our agency. I'd like management to re-examine over-professionalism and embrace transparency and authenticity. There needs to be a pay differential for different levels of education, a pay differential for employees who are bilingual and multilingual, and please keep caseloads at 75 clients per case manager or less to ensure quality care for our care receivers. Now here, let's span out at the structural intervention level for our care receivers again. First example, questioning bureaucratic barriers that deny access to services and advocate for those who are targeted and devalued. 2, consciousness raising. We can encourage clients to take part in advocacy efforts around caregiving and health access when they're able to and it affects them directly. 3, share power by demystifying professional technique and always involve clients in decision-making. Structural interventions for employees. Management should work to foster a positive environment, empower employees to come up with solutions in collaboration. And finally, the union is not the enemy. Allow the union members to meet on site during lunch hours again. And what if management and union members could work together to lobby state legislature in the future to continue funding waiver programs? I think it could happen. I think it could be powerful. So finally, if we take the courage to confront our own and others' imperfections, we can start to solve the contradiction of wanting neither to discourage the reporting of problems nor create an environment in which anything goes. Otswa is a complex entity, but savvy management knows that opportunities for improvement are lost when conversation is stifled. I want to leave with you a final quote by social worker Paul Kivel, who writes and speaks extensively about men's issues, racism, and diversity. Who we are accountable to is a crucial concern in a contracting economy during conservative political times, in which racial, sexual, and homophobic backlash is widespread. You may be discouraged about the possibility of doing effective political work in this context. You may be fearful of losing your jobs and livelihoods or lowering your standard of living. These are real concerns. But this is also a time of increasing and extensive organizing for social justice. It is an opportunity for many of us to realign ourselves clearly with those organizing efforts and reclaim the original vision of social justice, equality, and an end to the violence and exploitation which brought us into this work. Thank you for listening. I hope I sparked some ideas and conversation. Thank you so much.